you should definitely. Looks like we're live on Facebook. Excellent.
All right.
Yeah.
So welcome everybody. I'm Dr. Virgil Moorhead Jr. I'm part of the Big Lagoon Rancheria, which is Yurok and Talawa, and I'm excited to be part of this speaker series that we're doing at Two Feathers Native American Family Services. Two Feathers is about 5.5 hours north of San Francisco in Humboldt County in the town of McKinleyville, and we're doing a lot of work with Native American youth, particularly around suicide prevention and promoting wellness. I'm going to introduce I'm going to turn it over to one of my colleagues, Jennifer, and then Molly to introduce themselves, and then we'll introduce our guest, Dr. Ursula Whiteside.
Thank you, Virgil. Hi, my name is Jennifer Olefin, and I am the director for the CHEKWS Hope for Tomorrow intensive counseling program focused on suicide prevention at Two Feathers. Today is an absolute honor to be introducing our guest, Dr. Ursula Whiteside. Dr. Whiteside is a licensed clinical psychologist, CEO of NowMattersNow.org, and clinical faculty at the University of Washington. She treats high-risk suicidal clients in her small private practice in Seattle using DBT and caring contacts, and she is national faculty for the Zero Suicide Initiative. She also serves on the faculty of the National Action Alliance Zero Suicide Academy, and she's a founding board member of the United Suicide Survivors International and a member of the National Suicide Prevention Lifeline Standards Training and Practice Committee. So again, it's an absolute honor, and I'm going to hand it over to my colleague Molly. She's going to introduce herself and then kick off our interview.
Hi, Ursula. So my name is Molly Hildenburg, and I am a clinician in the CHEKWS Hope for Tomorrow program for suicide prevention, and we provide counseling for Native youth ages 10 to 18. And before we really dive in super deep, I just want to start by acknowledging that, it's Monday, June 1st, and right now there are protests erupting across the nation because of George Floyd's murder, a Black man by a white police officer. And it's just a really heavy time right now for a lot of folks. And we're just really honored to have you here today. But it just doesn't feel right to start without acknowledging what's happening. So with that, I just was wondering if you could talk a little bit about how we can connect everything that's going on with the work that you are doing for suicide prevention and Now Matters Now, and really thinking outside the box to meet the needs of people who are suffering.
Yeah. So obviously I'm an expert on a few things, but I wouldn't claim to be an expert on things that I'm not an expert on. So if I say something that you think, I'm not so sure about that, I take that humbly, and I take that feedback. So please give me that feedback when you notice. If you do, I appreciate it. I understand if you don't. The work that I do is largely focused on helping people get access to coping strategies, survival strategies from a treatment called dialectical behavior therapy. And the woman who founded that, the reason that the treatment evolved or came about was largely from an experience of injustice. Had she been a Black woman, had she been a poor woman, I suspect her experience would have been terribly extreme compared to what she experienced, and it was already quite extreme. So she was psychiatrically hospitalized against her will for several years as a teenager, this woman, Marsha Linehan, who developed this treatment. And I think what I think is most useful, and a slide that I show every time I give an important talk, is that giving people access to free resources that are useful resources is a form of social justice, in the sense that no one should have to tolerate injustice, but sometimes we don't know when or how we're going to make it go away, even if we're doing our best. And so the most compassionate thing we sometimes can do, or that I can do, is to make sure people have resources that they wouldn't otherwise have, that are often expensive or that you can't get in certain areas. And that's where this resource now comes in, is it's really expensive to get DBT. And the Now Matters Now website it's not DBT, but it's people who've been through DBT teaching what they learned, and tools that they can download for free and get started on, even if they have no access to care. So that's a little bit about what I would say. I saw that, during these times, we see a reminder of many of the things that Dr. Martin Luther King shared. And one that I hadn't heard before was about how being unseen or unheard contributes to violence. Because what happens when you go so long in so much pain without that being recognized? And that in the field of suicide, that really fits, that when people's pain is not acknowledged or treated, that's when suicides eventually occur. Not in all cases, but especially if you don't have access to resources. So I think that's a little bit of the overlap that I see. I definitely see my work as a social justice oriented mission.
Thank you for that. And thanks for acknowledging the disparities in our mental health care system, because it's very real and lived experience for a lot of people. And I know that this work, is really also very personal for you. So I was wondering if you could talk a little bit about what brought you into the field and
Sure.
your own experience, if you wouldn't mind sharing.
Yeah, absolutely. My mom, when she was a teenager, lost her older brother to suicide, and he was not much older than her. And so part of what I do is like out of respect and honor for her, I think, because like she went so many years where their family didn't talk about this, and they didn't have the information we have now to resolve or understand some of this. So it is like sort of a duty, not in a bad way, an honor of her. I think the other thing that would be true is I was really fortunate, because I had a lot of privilege, not financially, but all the other ways. And yet I struggled a lot, probably because we moved a lot, and probably because I was probably more sensitive. And so things just that wouldn't affect other people could sometimes knock me down in ways like just seeing a squirrel get run over. Like I might not be able to recover from that. And so part of that is beautiful, and having big emotion can build buildings, but also part of it is like, or it can throw you down. So when I got to college, I thought I was going to be a photojournalist, and then I took a psychology class, and it sounds pretty obvious, but like the idea that you could learn how to get things done, or you could learn how to be effective, didn't really seem like a real thing to me. I thought it was just magic, how some people knew how to do some things and others didn't. And I think especially if you grow up somewhere where you just don't get to see a lot of examples of how certain things are done, they seem so far off. And that can make it seem like they're like, that's just not something for you. But when you see somebody who's done it, it's so much more useful. But in places where like there's not access for people to learn how to do things, and then you don't see it because no one else before you had that access, that's really difficult. But essentially, I learned about this woman, Marsha Linehan, and how she was so focused on emotion. And I knew a little bit about the other mental health therapies and focused on thoughts and focused on childhood, and the emotion piece just really spoke to me. So I went and moved to the University of Washington in Seattle to work with her. But yeah, I've had suicidal thoughts, especially like I thought that life got easier as you got older. I was like, oh yeah, everything will get easier. But when I did have those, the most intensely, it was in a situation where I felt like I was being judged and wasn't seen, and I didn't see a way out of it. And so so that, way of looking at things and understanding pain it feels like it's seared into my spine. Like, I don't think I can not see that again. So yeah, that's a little bit about my experience.
Thank you so much for sharing that. And as a fellow sensitive soul, I really appreciate that. And just talking about like the importance of really feeling seen and heard. I think Jennifer, you have a question.
Yeah, and it's kind of, yeah, thank you. And it's related to what you're saying about, being in pain, but not having it modeled for you, how to kind of get through that and manage that. And in one of your other podcasts that you're a guest on that I listened to right before this, you talked about some of the panic around suicide and how, somebody who may be speaking out for the first time is responded to with some panic and maybe kind of taken to some emergency services or put in an out of home placement, maybe sooner than is warranted. And I wonder if you could expand a little bit more on that and just talk about, how our system is structured.
Yeah, I want to make sure to talk about the new recommended standard care guidelines. I want to talk about my team of people who have had lived experience. And there was one other thing that hopefully will come back. But what my team of people with lived experience, or Team Now Matters Now, say, and then other people I've interviewed, is what's most helpful is if you bring up that you're having suicidal thoughts or you fill it out on a questionnaire, that they don't panic. That when somebody starts to panic in response to something that you say, that's really scary. Because it's telling your brain like that you're too much and that this is dangerous. And and oftentimes your brain will interpret that as and that I should be ashamed. So a lot of the panic providers have is from not knowing what to do. And that's why the new recommended standard care guidelines that were put forward by like a number of different agencies and supported by bodies that accredit health systems, but by the National Action Alliance for Suicide Prevention. That's why they're so important, because they say to clinicians, no, these are the steps that you follow. And actually, these steps don't involve the emergency room. And this is the national standard for care. It involves identifying who's at risk, assessing to determine what type of intervention, and then doing follow-up caring contact. And that assessment for intervention, it might include for some people a trip to the emergency room, but for the vast, vast majority, it does not. The people that would go to the emergency room are those who don't have somebody around them and who have a plan in the next few days. For the vast, vast majority, that's not the appropriate place. And these recommended standards, like, they really back that up, especially for the licensed provider who's saying like, well, if they go to the emergency room and then they kill themselves, then it's on me, as opposed to saying, okay, this kid doesn't want to go to the emergency room, and this kid I can see in 2 days, and this kid's auntie like is on board. All of, like doing best care as opposed to doing care out of fear. So I mentioned the first thing that they say that they want is the provider to not panic. The second is for them to be present, even if it's in primary care, even if it's 30 seconds where the provider reflects back like, boy, the last 30 days have been a little bit torturous for you. Like, being present means showing that you're listening. And then the last of 3 things that my lived experience people say is to provide some type of hope. whether that be like, I look forward to seeing you again, I think we can, or I think we can get through this, or I really like seeing you. Like, don't let them leave without expressing some kind of hope for them. So those are the three things I think are so important. So we mentioned the recommended standard of care, which is identifying who's at risk. And I didn't mention this, but safety planning. So providing this plan for what to do when you're in a crisis. That's actually the second one. And then the third is follow-up caring contact. And then the three things with lived experience are don't panic, be present, and show that you have some type of hope. I think those fit nicely together and don't freak people out. As people, people with lived experience will say, like, I'm watching you to see how little or much I should share, because if you can't handle it, like, I don't want to put that on you, and or if you can't handle it, I don't want to have to deal with that. I've got enough to deal with. So those are some thoughts on that.
Yeah, thank you. God, such good points. And it makes me think too, the topic of validation kind of popped up in my head while you were answering, and it makes me think of, I read Marsha Linehan's book, and you certainly have much more experience with her, but she talks at length about validation, and I was wondering if you could speak a little bit about that as well.
Yeah, absolutely. So, validation can sound like this very special, fancy thing, but validation is, I see you nodding my, like, if I'm validating at its simplest level, I'm like nodding and uh-huh-ing, like at its very simplest level, or I'm liking a Facebook post, or I'm making a comment, thank you for sharing this. Those are listening or validating on its most minimum level. But the general definition is showing someone that you see them, which is when we come back to what's going on in America right now, and why, at least from what my friends say, it's so painful when people jump to stuff other than the historical trauma. They could be acknowledging what's happened first, but they're not. They're jumping to put attention on these other things, and that's invalidation. And then there's other layers of validation, like super complex validation, which is not a real term, would be like your friend is sick and you show up at the door with their favorite type of pizza, and if they don't want to come in, you just text and say, I left it on the doorstep for you. It's like, I know some of you are familiar with this, but it's like sort of seeing what they need and mind reading and it bringing them that for them. And I think with our our Black friends, our Native friends, because we know that rates among Native communities are also disproportionately higher in terms of violence. It's the same kind of showing up. Like, if they post something on Facebook, you dang well better acknowledge it if you're going to be validating, and there's validation that says, like, anybody going through that situation would feel the same way, or it makes sense that you feel that way given what's happened. So those are actually similar but different. There's the anyone going through that would feel this way, and then there's the it makes sense that you feel this way given the history and what's led up to this. So that's a little bit about validation, but it's key in dialectical behavior therapy, because change doesn't happen. And Marsha Linehan would say this directly. Change does not happen without validation, does not happen without acceptance of what's happened. If you do not accept what's happened, if you put it under the rug or ignore that it's happened, change is impossible. And boy, does that fit for our larger, what's going on in our country. It's like, we can't keep pretending like this isn't happening. It is not working. So.
Yeah, thank you.
So important.
Yes, and I want to do one more follow-up, and then I'll let my colleagues have a chance. Mm-hmm. I'm thinking about what you said and wondering how you go about working with families around this and teaching families how to do this for their person who is struggling.
Yeah, let me show you one thing that I would share. just take a second. Okay, so one thing that I share is this stress model video. So this is the Now Matters Now website. And I go to free training and resources. And then under that is something called the stress model. And there's a video here and then a PDF. So if it's okay with you, I'd like to play the video. Okay, okay, great.
If you're a person who has suicidal thoughts, one thing that might help make sense of it is the stress model, or Linehan's stress model, or the biosocial theory. Some of us have a baseline, a biology, a history that just makes us more prone to stress. And so our stress level in comparison to like the average person's stress level is just higher. And what happens if you walk through the world with a higher level of stress is that when something stressful happens, whatever that might be, our emotions tend to respond more quickly. They stay there for longer, and they take longer to come down than, say, the average person. What it does is it explains why somebody would want to escape, because what it shows is that some people have more intense emotions, more painful emotions, and that anybody who's having really strong and painful feelings often wants to escape those, wants to get away in any way that they can. And our brains learn all sorts of ways to get out. Those can be things like drinking, using drugs. Sometimes it's eating. Sometimes it's, distracting yourself with running or exercising, other types of exercise. But sometimes it's suicidal thoughts. There's some research that shows that having a suicidal thought can actually make you feel less bad. That is to say that if you're somebody who tends to have strong emotions and those emotions really wash over your whole body and are really intense, if that's you, then your suicidal thoughts make sense, because it's your brain's way of trying to get an escape from feeling so bad. And the good news is that when we think about it that way, we can start to find other ways to manage those intense experiences, to both prevent them, to manage when things are getting more and more intense, then to manage the hottest place, and then to manage afterwards. The DBT skills help with each different phase of that. And over time, they also help with the intensity, so that you get to choose how you react in situations, so that you can, if you want to feel that way all the way, you can go for it. If you choose not to, you can not go for it. You can do something else. That's the biosocial theory. And it helps explain why people do the things that they do and why they have suicidal thoughts sometimes.
I think what I want to say there is, like, what you're communicating to a family member is that some people are wired to have more intense emotions. They're to have stronger, longer lasting emotions, and they walk through the world with their stress level being higher. And when your stress level is higher, you're more vulnerable to emotions. The analogy I like to give, even with a caveat that it's not that simple, but the analogy I like to give is, okay, think of the time that you stubbed your toe when you walked it off. And now think of the time that you stubbed your toe that you wanted to punch the wall. Sometimes we react differently based on how stressed we currently are. So if you were already stressed and you stub your toe, your reaction is different than if you aren't already stressed. So for a family, I might draw that image and say, the thing is, if you're somebody who has this higher stress level and baseline stress level, then other people can't see it because you look the same as everyone else. But inside, you're wired differently. And so we have to understand that of course, some people's reactions are going to be stronger and longer lasting. And so I still have the share screen up because there's this PDF that I draw or use when I'm sharing family members or friends to just kind of say, yeah, there's two different types of people. And that's okay. This is due to whatever your baseline is due to your biology, your history. It's based on the injustice that your people have encountered. It's based on the microaggression that happened, a day and a half ago. Like, your stress level makes sense, but nobody can see it. All they see is the stuff on the outside. And when we understand that things are caused, then people can become more compassionate. And when we understand that we are caused, then it's easier to think of solutions or to try on solutions. So that's a little bit about that.
Yeah, thank you. And it seems like such a non-shaming, blaming, and kind of judgmental stance to take. Whereas I think when, families are experiencing a lot of kind of emotional expression, it can feel really frustrating, and it puts them in a position to maybe be trying to help in a way that might be inducing shame. And so I love this. I want to thank you for showing that.
Yeah, I want to add too that if you're living in a family where somebody is really already upset, your baseline will increase. And you don't know that that's also driving your response. Something that wouldn't have bothered you out of one kid, then when the other kid does it, like, it's because of the environment. And we have to be mindful of what our current stress level is because we impact others when we're reactive to it.
Yeah, it's such a good point. I think I'm going to move over and let some other folks get some questions in.
Molly?
Yeah, well, I just wanted to follow up with that because I like how you tie in making it like very, very relatable to both what is happening like systemically and also happening to individuals. And I really appreciate how you have such a non-pathologizing approach with this. Like, you haven't mentioned once like mental illness, right? And I feel so much empathy coming from you and all of your work. And so I was wondering if you could talk about like how your work with focusing on emotions and how you do that. I know that validation is a big part of that, but if you have any other strategies, especially for clinicians, since there's a lot of newer clinicians watching this from our agency, and I'm one of them. So yeah, if you have any thoughts on that.
Yeah, I'm going to give you guys an example of a coping strategy that on one level seems very simple, on another level, it takes a bit of expertise. So I just want to introduce it to you now. It can be life-changing. For folks with trauma, it's something to talk about first before you jump into. And the coping skill I'm talking about, and it exists in other places. Like, DBT by no means built anything brand new. They took what worked best and put it and packaged it together so people could get it in one place. But the skill I'm thinking of is called mindfulness of current emotion. And it is on the Now Matters Now website. The way that website works is you kind of scroll across to see different topic areas. And one of the topic areas is mindfulness of current emotion. But it's my firm belief that if we were taught this skill, all of us from childhood, there would be no wars. There would be, it would just be a totally different world. And what it is it's becoming and coming in tune with an emotion by feeling it in your body. Usually when we have emotions, we think about like how to get rid of them, how to work around them. Sometimes we think about how to make them work for us. But this is a type of witnessing of emotion. So the background is that emotions are in your body. Like, they're about your physiology. It's only because we built forebrains eventually that we started adding all these thoughts onto what emotions are. But they were there before. And what they were is in our bodies, and in part of our brain, but largely a physiological full body response to something in our environment. Now that we've got these thoughts on board, we're always analyzing and trying to understand and interpret, but we're not letting that emotion take its course, fill its course. And you can choose to pay attention to your emotion in your body by deciding and asking yourself, where is it that I feel something most strongly in my body? So I usually start like between my chin and the top of my hips. When I'm upset, I'll close my eyes and I'll say, okay. And actually, why don't we all do this together? Like, your physiology of your emotion in your body is not dangerous, but if today's not the day, that's okay. You can think about horses. Okay, so what I'm going to have you do is close your eyes, and what all we're doing is noticing the sensations, any sensations, and we're not labeling it pain or fear or anger, between your breastbone and the top of your hips. So I'd like you to take 3 deep breaths and scan up and down as you do that. See if you find anything, and be curious about it. Now I want you to choose one point that feels strongest. Maybe it's an aching feeling or a sinking feeling. Or maybe you'll think about horses. Then I want you to breathe in that feeling. Just the sensation, nothing else. You're not carrying anything else with it. Breathe it in and then let it go. Breathe it in and let it go. Breathe it in and let it go. Okay, I'm going to pause there. I wanted to give you a very brief overview of what it's like so that you would have questions to go from. And you're welcome to send questions my way if you have some way of doing that, either in the Facebook or some other way. But the idea is to get out of your thoughts and into your body. I know that most of us, or many of us, have shut off our bodies because it was uncomfortable. And maybe we had a big, overwhelming feeling or got afraid to feel the sensations. And that's okay too. Like, I guess I'm hoping that part of me being here is that it's okay to like cry. Like I can reinforce that idea that it's like okay to have an emotion on your team. I got choked up earlier. Like, I didn't apologize if you noticed. I just kept going. But anyway, you're feeling this sensation. And if you're a new therapist, I don't want you to start out teaching this quite yet. I'd like you to watch the videos and read on it and talk it through and practice it in your own life first. I think that's probably the first step. But it's changing, it's getting out of your head and out of your thoughts and going to the sensation. Like, you're not labeling it pain, you're feeling it and breathing it in. And I've a couple of times where one time it took 15 minutes, but the emotion had been really, really big. And another time it just took a minute, but eventually the emotion came down where it felt intolerable before. Sometimes I had to keep doing it over and over again. I also want to tell you on the Now Matters Now page under I forget the name of the link, top right, crisis help. There's a video walking people through a stop, drop, and roll for being on fire emotionally. There's also a a safety plan and a safety plan guide on free training and resources that includes a stop, drop, and roll for being on fire emotionally. The reason that's important is the day that many people make a suicide attempt, they didn't wake up that day thinking they were gonna kill themselves. What happened was they became on fire emotionally and they didn't know what to do. So just think of if you got on fire physically and hadn't learned stop, drop, and roll, you might do things that were really unhelpful, like run around screaming. The same is true for all of us. Like, nobody told us what to do when we became on fire emotionally. And so we pulled together experts and came up with 3, and it's cold water because that reduces that emotional intensity really quickly. It's explicit instruction to not make any important decisions right away, to just hold off. And then the last one is to make some kind of connection with another being, to make eye contact with another being. If you have to do it over Facebook Messenger because of COVID, or if you need to do it with your pet, then do it with your pet. But some kind of human connection to get somebody out of that mind space that's so focused on suicide, or could be using, it could be violence. They need something that's strong enough to pull their brain out of that. And we think eye contact is one of the most powerful ways to pull your attention out of a really intense state. So I mentioned mindfulness of current emotion, and then I mentioned this idea of like a stop, drop, and roll. The cold water, the ice water, is a DBT skill specifically. You can find all that on Now Matters Now.
That's really great and so helpful. I loved that exercise. And it made me think a lot about lived experience, like you've been talking about. And before we came on, you mentioned the United Survivors Network that you are a part of. And a lot of our young people that we work with are also helping other friends who are going through it. Like, we're just a blip in their lives, right? Like, we see them just a tiny bit, but then I hear about some of the youth I get to work with who are really putting themselves in front of, like reaching their friends first. And so I just thought maybe if you could touch on like maybe some approaches or strategies for them as well,
Yeah, I think, so there's a course on my website that will always be free. It's called Microinterventions, and it's originally for clinicians, but I keep modifying it to be more and more like for anybody. So for the person who's struggling, or for the friend or family member. But a big focus of the course is teaching other people ways to cope by using examples of how you coped in your own life. So it's like teaching cold water, because by saying, okay, here's what I did, would you be interested in trying this out? That piece of having tried it and it being an evidence-based strategy and then offering it is one thing. Then of course this is self-care for the person who's just takes care of people all the time. Some people's way of taking care of themselves is by taking care of others. And Marsha Linehan used to say that, like, we don't necessarily know what's best for other people, and we shouldn't necessarily assume like what they're doing is not best for them around helping others, which I always thought was pretty interesting. I certainly find, I shouldn't say that. I find things that other people don't find exhausting, and working with people who are struggling, I don't find that exhausting. So how do you take care of yourself? So if you go to the website unitesurvivors.org, what you can go there is a course on how to tell your story, and that's less about taking care of yourself and more about storytelling and how to talk about what you've been through. That course is anywhere from $10 to $30, I think. And that might be something like people, want to do, or they can do the one on Now Matters Now that's free too. So.
Thanks for all these resources. They're incredible. Virgil, did you have a
Yeah,
question?
I had one question to take it more from sort of the individual, maybe family level, to some of the things that you're doing at the sort of systems level, and how you've created and developed an organization. And I'm reading your interview on the Huffington Post. You had said that you had to step outside, think outside the box, and entrepreneurship was one way that allowed you to really push back against systems and just following the rules. And I think that's one thing that we're trying to do at Two Feathers, is that the mental health system hasn't historically, or I think even currently, worked for Native communities. And you quoted the Native American high rates of suicide as an example. And so my question is like, what are you doing currently, or if you wanted to talk a little bit about any work that you've done to advance the field of suicidology, and where do you think we need to go to meet the needs of communities such as the Native American community?
Yeah, so what I ended up learning, and something I heard from somebody else really smart, but I learned it the hard way, was run from a fight, is what they said. And you know, people didn't like what I was doing when I worked in traditional academia. And then people in the suicidology field didn't like what I was doing because I don't even know, because they wouldn't tell me to my face. But what I did was try and reach out to communities that I cared about and see how I could be helpful. So I'm going to show you an example of one that I'm hoping to like adapt for Native communities. So I'm working with Colby at Northwest Portland Area Indian Health Board to try and do some of this stuff, but to bring free training. But then also, so this is an example. This is the county I'm from in Minnesota. We created this website specific to the county, and basically we created a link to all these free resources that people could get online. And we've created billboards, but also we're training the health system providers on how to provide better care. So instead of an hour-long assessment, how do you ask the question and then immediately link them to free resources and support them to use those resources? So like this is one resource is, trying to get people in the community aware of this free resource that I got permission to give away certain things that usually cost money. So I'm trying to make, there's essentially like public health arm, like where anyone can get access to things that work right away, 24 hours a day. And the other arm I'm trying to do is train healthcare providers in a similar way. I'm trying to be helpful here, which is like you guys are way ahead, but like in what are the recommended standard care guidelines? Here's how to do that. Here's a guide for how to do that. And then I'm trying to create ambassador programs because, we need other people doing this work and sharing this work. And so on all my programs, I'm trying to train people up so that they can do and carry the work if they find it beneficial to support that. So I hope that kind of answers your questions, but I'm trying to like make very targeted the resources that exist and say, this is for you. And we want your community members to benefit from it. And if they do, we want them to promote it and learn how to tell their story and, make sure that they get support. And then we want healthcare to, especially in rural counties, like get healthcare CMEs for free. Like you guys all, you all have access to free online CMEs because you serve tribal members and you're a tribal health system. So I will always be giving my CMEs for free to tribal health systems. And the way that you can find out about that is you go to, oh, I shouldn't do that. Let's try this. Ursula Whiteside, oops. UrsulaWhiteside.org training, And then there's these different classes. Some of them you need to take in a certain order. But if you indicate that you're a tribal health system, you'll get the hours for the continuing education hours for free. So anyone can take the classes for free, but most people have to pay for continuing education credits. Yours will be free. Right now, that's 2, 4, 26. That's 30 hours that you guys have free access to. So please make use of it. And it's not perfect because I don't have that much money, but I think there is some really good content in there.
Wow, that's really amazing. And I just, your commitment to making these tools and skills and approaches accessible and for free is just really, I'm inspired and I really, really appreciate it. And I hate to be the bearer of bad news, but we are at the end, unfortunately. We'd love to, I know, we'd love to keep chatting with you, but I wanted to kind of bring us, oh, it looks like you might be showing us one more thing too. I'm sorry.
Yeah, no, that's fine. I'm just trying to show where you could register as a tribal health system, but it should be in there. Yeah. Go ahead.
Awesome. Thank you. Yeah, I just wanted to ask you one more question to kind of close it up. And we may have already touched on it a little bit, so it's up to your own interpretation. But I was just wondering, what is something that you are working on that you might be really excited? So something new coming up, or a project you're launching, or something we maybe haven't touched on that you are excited about.
So that that course that's 2 hours that originally was for clinicians, and I'm adapting it for non-clinicians. I'm working on making it an even more tailored course for people who are lived experience who are struggling in the moment. Peer support can take the other one, and families can take the other one, but this one I'm hoping, so it'll be free, Now Matters Now. And I don't know, I just sometimes having something that's guided works better than just a bunch of videos. So I'm hopeful about that.
That's amazing. I'm now also excited about that. All right. Well, thank you so much for spending time with us and talking to us. And I have a few announcements to make before we shut down today. I wanted to announce that we have our speaker series, our narrative therapy speaker series is continuing also at Two Feathers. Our suicide prevention speaker series, which you heard today, is continuing on. We have Dr. Elliot Groves on July 2nd at 12:30 p.m. and Dr. Cheryl King is to be determined. With our narrative therapy speaker series this week, we're going to be interviewing Ronnie Schwartz on Thursday at 12 p.m. and we have Dr. David Nyland on June 9th at 12 p.m. We also have some other exciting speakers that we're trying to determine a time. And I think Virgil has a few other announcements as well.
No more announcements. I just think, we continue to have the Indigenous speaker series. I just wanted to thank Dr. Whiteside, and, hopefully we can continue to collaborate. And we have, questions from the audience. If you have any, just send them on the Facebook comment section, and maybe we can try to get those answered from Dr. Whiteside if there's any pressing questions. But I just want to thank you again for your time and the valuable insights and information you gave us. And maybe just if you wanted any to throw out any last words, or, where we can find you, anything you wanted to offer our audience.
Well, I keep thinking about your question about, like, how do you do the thing that hasn't been done? And I guess expecting that it will be painful could be a little bit helpful. Like, just knowing, like, this is part of the process. Like, I think I kept thinking, why is it so painful? Why is it so painful? When if I had thought, oh, this is part of growth, and people don't necessarily like growth, and that's okay, and I got my A team, it wouldn't have been so painful. So if you got people you trust and you love around you, and you guys know, okay, we're going to do this and it's going to be hard, we're not even sure what we're going to do, but we're going to do it. Like that helps.
Thank you. Yeah, and it seems like that's one of the things that we admire, or I admire about your work, is that you've brought together and really helped to develop or further a movement around these issues such as suicide. So thank you.
I hope so. I kept forgetting to tell people, just call me Ursula, but
Okay.
in the last 0.02 seconds, I remembered. Okay.
All right.
I'll stick around in case there's any questions. I'm going to
Okay.
try to find you on Facebook right now. Your Facebook.
So
I see it.
see you all tomorrow.